We do recommend accreditation. Our biggest example really is working with our insurance companies, particularly Medicaid in our state. There was a point years ago when there was a question about our risk criteria for freestanding birth centers in Minnesota. And it didn't really even have to be much of a conversation because the simple fact that we are CABC accredited establishes the risk criteria for freestanding birth centers. And it also means that no one else needs to be regulating us outside of our accreditation. So it was nice because they took that feedback, they looked at the indicators, they looked at our accreditation, and didn't pursue that any further. We just had our 6th accreditation site visit, and CABC I've seen take the feedback of birth centers who've gone through accreditation and really implemented those changes of making it a more streamlined process, taking out some of the duplication that we've seen, making it easier to submit documents. The 2 resources I think that are the most helpful are the How to Start a Birth Center workshop. And at the workshop, we talk lots about then downloading those indicators from CABC's website for accreditation, because they're going to fill in those gaps of things that you're not aware of that you need to be thinking about for your birth center as you open. So for those new birth centers, it's important kind of as that blueprint. Then as you continue and as you're operating your birth center, it helps you stay on that trajectory of providing safe, appropriate care and making those changes in your birth center that you might need to make to just operate optimally. Our experience with CABC is they're wanting to help you run your birth center as best as possible. So when they're coming in, sure, they're evaluating your systems and they're looking at your building and they're asking lots of questions to your employees and your transfer hospitals, but they're doing that to gather the information to say, hey, maybe you can be doing this better. So when you get that decision back, maybe you get something that says some of the indicators are partially met. It really means that, hey, these are things that you can improve on, make some changes, submit them to us, and then you have your accreditation. So I really think of it more as that learning process instead of that punitive process. Licensure, accreditation, anything you do that way will come with an expense. How we've made it work for our birth center is really working on a payment plan. We've split those payments up on a monthly basis, and so that makes it much more palatable. I actually don't even really think about it. So that when it comes time for our site visit, our fees are already paid.